Let's get back to the audience. I want to bring in Rayellen Smith, who's an accountant and Democratic activist from New Mexico, who says she's planning to run for office in 2 years. Rayellen.
Thank you.
Thank you so much. My question is about Medicare for All, something that intrigues me quite a bit. My question specifically is, what is your position on Medicare for All and the impact it might have to the insurance industry, thousands of jobs being lost, and a potential large segment of our economy vanishing?
Yeah, sure. Thank you for stepping up to run for office when you do. That's an important thing. I support Medicare for All, and I want to tell you why. It is unacceptable that in our country we pay far more for health care than any other country in the world, yet we have far worse outcomes than any other country in the world. We have to look at why that is, and we have to understand that in this country, it's unacceptable for anyone to be sick and in need of care and not able to get that care simply because they don't have enough money. So Medicare for All, which we are paying right now with the high cost of health care that we are paying, Medicare for All would take out that insurance company that we are writing a big check to every month, and instead we would be able to lower that cost of health care by taking out that bloated administrative fees and the heavy profits that insurance companies are making on the backs of sick people in this country, and instead write that check for Medicare for All, where we would have that coverage for everyone. There's a lot of things that we have to look at what are driving the high cost of health care. So on its own, Medicare for All is not going to solve everything. We have to address the high cost of prescription drugs. Right now, Medicare today still can't negotiate with prescription drug companies to bring down that cost of health care. That has to change. Being able to re-import drugs from places like Canada at a cheaper price is something that we have to be able to do. Focusing on preventive health care and trying to make it so that less people are getting sick in the first place is a great investment that we can make in this country. So I believe that we have to come at this from a comprehensive approach, from a holistic approach, as we look to bring down the cost of health care and make sure that everyone who needs that care, who wants that care, is able to access it.
Can I just drill down on this just to make sure I'm hearing you right? Do you believe that all private insurance should be eliminated?
I don't. I think Medicare for All, in and of itself, by providing that care, that basic level of care, which would include dental and vision to people, would take away that insurance middleman, that high cost that we are paying right now. If people want to go and get private insurance for something else or something that they're not seeing is being fulfilled, then of course they should have the freedom to do that.
What would that insurance be for? Because, you know, the argument is that if you go that far, that then the private insurance markets will bottom out. They
well,
won't
the thing is, today, insurance companies are not allowed to offer coverage for things that are already covered by Medicare today. So by expanding Medicare for All, this wouldn't change that. If there are other services or other needs that insurance companies see that they have an opportunity to fill and that people would want, then this is a free country. They'd be able to do that.
Let's get back to the